Hello, welcome back to my channel RV Bearing Knowledge Booster. Today I am going to discuss about the topic Salpingitis. Okay, so here Salpingitis, it is the inflammation of the fallopian tubes. That means fallopian tubes it become swollen. The fallopian tubes extend from the uterus, one on each side, and both open near an ovary. Okay, and this salpingitis, it is one of the most common causes of female infertility. That means for which the woman cannot become pregnant. The infection is usually polymicrobial in nature. Okay, usually both the tubes are affected, and if salpingitis is not promptly treated, the infection may permanently damage the fallopian tube so that the eggs released its menstrual cycle cannot meet up the sperm, for which the woman has to suffer from infertility. Here the organisms responsible are: first is sexually transmitted organisms. These are gonococcus, chlamydia trachomatis, mycoplasma. Here the infection ascends to the tube through continuity and contiguity, attacking the tube from inside, which is known as endosalpingitis. Next is pyogenic organisms. These are streptococcus, staphylococcus, and E. coli. Here the tube is affected mainly from outside. Infection from uterine cavity and cervix produces pelvic cellulitis through veins and lymphatics. Next organism is tubercular. Tubercular organism, that is Mycobacterium tuberculosis. Here the infection reaches to the tubes through bloodstream from the distant primary sites. There are two types of salpingitis, that is acute salpingitis and chronic salpingitis. In acute salpingitis, the fallopian tubes become red and swollen and secrete extra fluid so that the inner walls of the tube often stick together. The tubes may also stick to nearby structures such as the intestine. Sometimes a fallopian tube may fill and bloat with pus. There is intense hyperemia with dilated vessels, which makes the wall enormously thick and edematous. In rare cases, the tube ruptures and causes a dangerous infection of the abdominal cavity, especially that is peritonitis. Endosalpingitis too often produces loss of cilia, which is responsible for infertility or delay in transport of the fertilized ovum. Next is chronic salpingitis. Here, it usually follows an acute attack. The infection is milder, longer lasting, and may not produce many noticeable symptoms. Here, clinical manifestation, that means signs and symptoms are: the symptoms usually appear after a menstrual period. The most common are abnormal smell and color of vaginal discharge, pain during ovulation, pain during sexual intercourse, pain coming and going in periods, abdominal pain, lower back pain, fever, nausea, and vomiting. So complications of salpingitis are: without treatment, salpingitis can cause a range of complications, including further infection. Here the infection may spread to nearby structures such as the ovaries or uterus. Next is infection to sex partners. The woman's partner or partners may contract the bacteria and become infected too. Next is tubo-ovarian abscess. About 15% of women with salpingitis develops an abscess which requires hospitalization. Next complication is ectopic pregnancy. A blocked fallopian tube prevents the fertilized egg from entering the uterus. The embryo then starts growing inside the confined space of the fallopian tube. And next complication is infertility. The fallopian tube may become deformed or scarred to such an extent that the egg and sperm are unable to meet. After one bout of salpingitis or other PID, that means pelvic inflammatory disease, a woman's risk of infertility is about 15%. This rises to 50% after 3 bots. Next treatment. Here in treatment, salpingitis is most commonly treated with antibiotics. Prompt treatment and contact tracing minimizes complications. Admission is done, blood culture is taken, and IV antibiotics are started. In severe cases, antibiotics such as cefoxitin, slow IV with doxycycline initially, then doxycycline with metronidazole until 14 days can cover gonorrhea and chlamydia infection. In less severe cases, ofloxacin and metronidazole for 14 days. Once the cilia is damaged, commonly with gonococcal infection or when involvement of the wall in pyogenic infection impairs the motility, the prospect of future fertility is very much poor even with reconstructive surgery. So thank you for watching. Please do subscribe the channel.